deficit, but much more work remains. Joining me now are two members of the House of Representatives from Louisiana, Republican Congressman Steve Scalise, and from Louisville, Kentucky, Democrat John Yarmuth. Gentlemen, thank you both for being with us here on America's News Headquarters. Let me see if I can start first of all. Now, look, the Senate bill that is sort of emerging and seems to be gathering a little momentum is sort of revenue neutral, but it doesn't have a public option. So I'm wondering, the House still seems to be leaning toward passing a bill that would have the public option, but I'm not sure it would be revenue neutral. So where are we? Congressman Yarmuth, you start.
Well, I think the House is definitely going to pass a bill that has a public option. And remember, the reason for a public option is to provide some competition for the private insurance companies, which are making out like bandits over the last decade, and while still 47 million people are uninsured. The question is, again, how we're going to pay to bring the vast majority of those 47 million uninsured into the system so that we can stop the cost shifting that's going on now, because every American who has insurance is paying $1,100 a year.
Congressman Scalise, let me let you get in there. What do you think about how it's going in the House, and how will they pay for this?
Well, I join most American people who think that we need to make reforms to the system, but we don't want the government taking over our health care system. If you look at the House bill, it still adds another $239 billion to our national debt. But what they're doing both in the House and Senate is adding hundreds of billions of dollars of new taxes that are going to be paid for mostly by families in the form of higher costs for health care, and they're cutting $400 billion in both bills to Medicare. And so I think our seniors recognize how dangerous that's going to be. I think both of these bills are the wrong approach. What they need to do is scrap this whole idea of the government getting involved and having all these new taxes, and let's go to a real common sense approach that provides lower costs and addresses things like pre-existing conditions, which are real problems we can fix.
Let me get Congressman Yarmuth back in here. Your reaction, sir.
Well, the problem, I mean, there's so many misstatements there. First of all, the $400 million in savings that we find in Medicare is based on a total expenditure of about $7 trillion. So you're talking about about 5%, where we think there's being unnecessary expenditures being made that we can take and reinvest in our health care system to provide a more efficient care. But talking about raising taxes on middle-class families, I mean, we're trying to get an individual mandate in the House bill so that people are forced to buy insurance. We think that everybody needs to participate in this. Is shared responsibility.
Isn't this really going to all be decided in conference, though? And what comes out of conference has to be something that all sides can sign off on and is going to be signed by the president. The president says he won't sign it unless it's budget neutral.
Well, that's exactly right. And, you know, Steve mentioned $239 billion. The reason that figure keeps coming up, that's a physician payment fix that we're going to have to do whether we do health insurance reform or not. That's not part of the reform measure we're talking about.
Right.
We are committed to making this budget neutral or deficit neutral over the next 10 years. We've got it down to about $900 billion, and we're going to figure out a way to pay for it.
Congressman Scalise, you get the last word.
Well, people know that when you're talking about hundreds of billions of dollars, what they're really talking about is massive increases in spending, the government taking over health care, $400 billion in cuts to Medicare and Medicaid. If they've got those savings out there, they can go get them today. They have yet to show where the savings come from. Seniors know they're going to cut Medicaid, and these new taxes, $400 billion in new taxes. Families that are making less than $50,000 see that they're going to be paying more. Over $20 billion in new taxes on people who don't have insurance, who make less than $50,000 a year. This is a bad bill. They need to start over.
I hate to cut you off, but we're out of time. Gentlemen, thank you so much for joining us on Saturday. We appreciate you contributing to the continuing